Welcome back to another episode of the Dr. Joudeh Effect. One blue bruise, 1,000 hot takes. Tonight, we try to diagnose the myth, not the man. You've seen the photos of President Trump's bruised hand, sometimes covered with makeup, sometimes not, and the internet spiral that followed. Let's separate physiology from politics, and then answer the hard succession questions. Aging skin, tiny bumps, and aspirin equals big bruises. No conspiracy required. In older adults, flat purple patches on the back of the hands or the forearms often indicate something called actinic purpura, a sun-related benign vessel disease that indicates fragility and often bruises with minor trauma. It looks traumatic, but then fades. Aspirin and other antiplatelets don't cause the bruise, but can make it larger and longer lasting. That combo is textbook. The White House has attributed the hand bruise to frequent handshakes and has also said that Trump suffers from chronic venous insufficiency, also known as CVI, to explain his leg swelling, which tracks for the legs but not for the hands. Different mechanism, but both can be true. Bottom line, journalistic photos document. They don't diagnose. A repeating hand bruise in a 79-year-old on aspirin is a common pathology and should be further investigated. But location matters. Nobody shakes on this side of the hand. When transparency is thin and the makeup is thick, the rumor mill does the rest. A quiet holiday weekend, visible concealer, and no doctor on record to answer questions equals viral "is he dying" content. The rumor cycle peaked during Labor Day, then collapsed once he was back on the golf course and taking meetings. The lesson: partial disclosures invite maximal speculation. LVADs, or left ventricular assist devices, are used in cases of severe heart failure where the function of the heart is deteriorated or diminished to almost nothing. It requires 2 cables exiting through the abdomen attached to a controller and 2 batteries that you must be wearing at all times throughout the day. You often cannot feel a pulse in these patients because the machine gives a continuous flow. If the president had one, you'd expect visible gear, cables, belt packs, and battery swaps throughout the day, or at least a hospitalization timeline. We have none. The official letter says no heart failure. It does say CVI for leg swelling along with his taking aspirin. So the LVAD claim seems to be a myth built on a blurry bulge. Medicine says no evidence. If a president dies, the Constitution doesn't blink. The 25th Amendment, Section 1. In case of death, the Vice President shall become President. Today, that's Vice President J.D. Vance. No gap, no vote. Step 2. Fill the VP seat. The new president has to nominate a vice president, which needs to be confirmed by the majority of both chambers. If both the president and the vice president are simultaneously unavailable, the Speaker of House is next in line. And so on begins the Presidential Succession Act of chain of succession for those that come after, should any one of those positions be unavailable in that order. A bruise cannot choose a president, but clear information can calm a country. Medically, the simplest story often wins. Politically, clarity is the antidote to rumor. If the worst should happen, the line of succession is automatic by design. Thank you for watching. Please like and subscribe, and join us for more on the Dr. Joudeh Effect.